situation. The horizontal aspect, this is your career. This is your, from dental school to grave, this is your whole career in the horizontal aspect. The vertical axis represents the level of fulfillment, success, joy, jazz, buzz that you have about what you're doing in your practice. In the beginning, we experience a fairly rapid increase in our success. It's easy to be successful in your first decade of dentistry. Why? Because every direction is up. You graduate school, you get into associate, maybe you get into a partnership relationship, you take some courses on occlusion, take some courses on cosmetics, and every year seems better. You get a new car, you get a new girlfriend, life is good. But what happens after about year 8, 10, 12, what happens in many practices is that we hit a plateau. And that plateau isn't always obvious. Typically it happens, the practitioner's been out there for about 12 years. It's about 2 o'clock in the morning, and he's laying in bed, and he wakes up and he looks up and he says to himself, where has all the money gone? I am loaded with patients. I'm as busy as I can be, and yet I'm not happy. If I'm so successful, why am I not happy? And it's this plateau that a lot of us find ourselves on. The reason the plateau happens, and this is not unique to dentistry, this is unique to life. The reason the plateau happens is that success breeds an unintended consequence. The unintended consequence of success is complexity. The more you're successful, the more complicated your life becomes. My friend Mark Davis practices in Clearwater, Florida. Arguably one of the best dentists alive today. Mark is wonderful. And Mark has this theory of 5. He says, when you get more than 5 employees, you really lose control of your practice. He said, if you got 3, you got one sitting next to you, you can kind of keep an eye on her, and you can hear the hygienist, you can hear the girl down the hall. You get 5, but once you get 6 or 7, the complexity increases. And what happens is that as we get successful in our practice or in our life, and this just doesn't have to do with dentistry, this has to do with life. As we get successful in life, what happens is that the complexity of our career, it gets more complicated. And as it gets more complicated, we got to work harder to overcome that complexity. And we reach a point to where there's an equilibrium reaction between the complexity holding us back and our will to grow. And when we reach this point of capacity, the harder we push on our practice, the harder our practice pushes back. And you can stay on this plateau your entire career. You can collect between $60,000 and $80,000 your whole career. And there's nothing wrong with that, except that over time what happens is that we get tired and the practice can get into decline. 2 big reasons for decline. Number 1 is surrender. If you've been pushing your practice, if you've been stuck on a plateau, and if you haven't been happy and you're frustrated and you're trying to grow your practice, you put in performance systems and get new technology and take courses in implants and cosmetics. You try to grow your practice and you just can't budge it. What happens is after a while, you surrender. You put in a nice veneer case, it's beautiful, and the woman's smiling and happy, and she goes up to the front desk, and everyone's happy, and this poor old guy, he walks out of the operatory, the dentist walks out of the operatory and goes up to the front desk and says the magic words, "Did she pay?" And the administrative people, they're looking at each other like a tree full of owls. Who, right? No, she didn't pay. Well, be sure you get it. And he just kind of slouches back in the operatory to grind on a tooth. Surrender of the owner, and after a while, that can get old. There's a bigger reason we're going to see declines in some practices because of the tremendous amount of dentists who are going to be retiring in the next 10 years. And they're going to be bringing in young partners. And here's Dr. Senior. Dr. Senior has done a good job of dealing with this complexity. And then comes Dr. Junior, and you know what? Dr. Junior, the new owner, can't handle the inherited complexity. Many of you are going to be dealing with that issue. As a trainer and as a coach and as a consultant, I'm dealing with it now. And Dr. Senior has taken so much for granted. His team has been around him for so long they can read his mind. The new guy comes on, you can see some problems there. Now, what I'm going to suggest to you is what my experience has been. What my experience is that you can experience a second growth curve in your practice. A second growth curve. The genesis of the first growth curve, though, was clinical skills. Remember that? You took the courses, you went down to Dawson, you went out to Pankey, you got new skills, and that created the first curve. But you know what? If you think about it right now, would another course in occlusion, would another course in cosmetics, would another course in TMJ, will that really get you off the plateau? You took more clinical training? No. The second growth curve does not come from a clinical origin. The second growth curve comes from what you do personally with who you are. The second growth curve is driven by leadership. That's what today is about, is looking for and creating that second